Evening, sir.
Good evening, sir.
Okay, so sorry for the late connection, guys. Actually, suddenly my login is not working. So thank you, Afrin. Right, so Afrin only helped me to get the login. Okay,
It's okay, sir.
so yeah, uh, yes, so everyone is connected. So you guys tell me, what is the last topic we are discussing, guys? Can anyone remember?
Maternity and delivery was the present abortion.
Yes. So
Abortion we will discuss today, no, sir?
yes. So in our last session, we are discussing the hysterectomy as well as the maternity and delivery, and then abortion. I hope we need to discuss today. Okay, before that, I want to discuss that question, guys. Right? I think most of them you guys are sending answer. It's a good try, right? So now I will discuss the correct answer. Okay, so this is the question. So what does the question mean? The woman has carrying twins coming to hospital for delivery. She underwent vaginal delivery, baby A born. The position B was complicated, so doctor decided to go for C-section and baby B born. Both mom and babies fine. Okay. So you guys say answers, but please note down, guys. The correct answer for this question is 59410 59410, comma 59510. 59410, comma 59510. So this is the answer. So I will discuss why this is the answer. Right, I will discuss because you guys nearby some of the candidates will come, but I am not getting the exact answer. But it's okay, guys, because in this particular topic, mainly this question, it's a highly challenging one. I will discuss. So why this is the correct answer. So you guys see the screen 59410, 59510. So 59410 we are given 213, 213, and then 59510 is the 123. Okay, what is 2? What is 3, guys?
So 2 means delivery and 3 means postpartum.
Okay, so 2 mean it's a delivery, and then 3 mean postpartum. Okay, so why we have to use 59410 mean? So the provider perform vaginal delivery, so the 2 will come. It's common. So why sir 3 will come like that mean? So 3 mean postpartum. I'm informed. So postpartum mean what is that, guys? What is postpartum?
After delivery.
Yes. So what I said mean after delivery, if the provider perform any procedure or any service, we consider as a postpartum. In this concept, after normal delivery, what procedure the provider perform, guys?
C-section.
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 Yeah, that's all. So after delivery only C-section perform. That's why we have to consider this is the answer 59410. Clear, Clear? After the normal delivery only C-section performed. That's why the C-section is the postpartum for normal delivery. So we have to use 59410. Okay, sir. Then why we have to use 59510? So 59510 we have 1 and 2 and 3. So 2 you guys know the C-section performed. So 2 and both mom and baby fine is there. So 3. So 1 why is a perform? So 1 mean what, guys? What is 1?
Antepartum.
Antepartum before delivery.
Yes. So antepartum. So 1 mean antepartum, which mean before delivery, if the provider perform any procedure, we consider as the antepartum. So C-section before what will happen, guys? What happened? C-section before what the procedure will perform?
Vaginal delivery.
Yeah, it's a vaginal delivery, right? So this is we have to consider as an antepartum. So what is the concept in this question you have to follow mean? If before or after, if the provider perform delivery also, you consider as an antepartum postpartum. That's all. So that's why the answer is 59410, 59510. This question directly you guys are receiving in your exam. So you have to plan accordingly. Clear? That's all, guys. So next thing is abortion. You guys already note down this or we need to note down, guys?
So noted.
Okay, already note down, right? Okay. So the abortion means it's a termination of pregnancy. In this abortion, we have 5 types is there. Missed abortion, induced abortion, complete, incomplete and septic abortion. The first one is the missed abortion. We have 2 code, 59820 and 821. You guys check and tell me what is the difference between 59820 821, guys?
820 for first trimester and 821 for second trimester.
Yes. One is the first trimester, another one is the second trimester. Okay. So what is trimester, guys?
Weeks.
What is trimester, guys? Any idea?
And 9 months are divided into 3 parts. That is first trimester includes 3 months, second includes 3 months, and last third trimester includes 3 months. That's all.
Okay. Actually, in India, we all are calculated the month, right? For example, if the patient is pregnant, mean what we are asking, what is the month? So they said this is the 7th month, 8th month, 9th month, like that. But in US, it's totally different. They have to calculate it weeks of gestation, guys, right? So in US, they calculated weeks only. So you guys please note down, this is very much important. The weeks mean how we have to calculate it mean. The first one, first trimester, you guys please note down 0 to 40 weeks. please note down, guys. This is helpful for your CPT as well as the ICT. That's why. So 0 to 14 weeks we consider as the first trimester. And 14.1 day to 14.1 day to 28 weeks we consider as the second trimester. Zero to 14 weeks considered as the first trimester. 14.1 day to 28 weeks we consider as the second trimester. And then 28.1 day to 28.1 day to during delivery. Clear? That's all. Okay. So again, I repeat. 0 to 14 weeks, 14.2 28 weeks, 28.2 during delivery. So this is called as trimester. Okay. So now the missed abortion mean this abortion will happen within this 2 trimester, right? It comes under first trimester or second trimester. So you have to check which one the product perform, right? So based on that we have to build. And next one is induced abortion. And one more thing, guys. Some candidate they're asking, sir, only we have 2 things is there. So why we don't have the code for third trimester like that? Guys, the missed abortion will not happen in third trimester. So that's why we have only code in first trimester and second trimester, right? Okay. So next one is the induced abortion. We have 2 code, 59840 and 841. So please note down, guys. 59840 is DNC. DNC. And then 59841 is
DNA.
DNE. DNE.
Got it.
right? So 59840 mean it's a DNC, and then 59841 is DNE. So this is the difference. So actually the abbreviation they already given in your CPT book. So DNC mean dilation and curettage, DNE mean dilation and evacuation. But the provider will not using the full term. The short term only they are using DNC, DNE like that. The short term only they are using, right? Okay. The next one is the complete abortion. Guys, please note down this. This complete abortion, you guys are reflected in your exam. Clear? So complete abortion, this one will reflected in your exam, guys. Right, this one will reflected in your exam. So what does that mean? If the provider documented complete abortion is performed like that, that time you guys no need to code anything. The complete abortion is performed, you no need to code anything. Directly we have to code E and M. That's all. You have to choose the answer E and M. That's all. Right? Guys, again repeat how this question they are asking me. The provider perform complete abortion. What code you have to use? Like that they are given. And then option A, they given. Option A, they given 59840. And then option B, 59842. And then option C, E and M. So like that they given. So you have to give the answer E and M. So like that you have to choose. Clear? So this is the plan. And then the last thing, incomplete abortion and septic abortion. So incomplete abortion mean you have to give 59812. Incomplete abortion mean 59812 and septic abortion mean 59830. Right? So this two is the direct one. Incomplete abortion mean 59812. Septic abortion mean 59830. So this is the thing. So overall from this abortion you guys are receiving one question, mainly that question from complete abortion. That's all guys. Clear? So that's all about chapter 5. So overall, the maternity delivery, hysterectomy, abortion, and then you have to concentrate on circumcision, and then cystoarthroscopy, and then the donor nephrectomy. So you have to concentrate all those topics. From these only you guys are getting answer. Right? That's all. Okay. Okay. So that's all guys. So that's all about chapter 5. So till now we are done. Anesthesia 4, 5, and then modifier. So next topic, please note down chapter 6 guys. Okay. So next one is the chapter 6 guys. Right. So chapter 6 we are receiving 6 question guys. Okay. So chapter 6 we are receiving 6 question. So the first one, and one more thing guys, in chapter 6 we have multiple chapter involvement also. So what does that mean? The first one is the endocrine system, guys. Please note down. The first one is endocrine, and second one is the second one is nervous system, and next one is ear and eye procedure. So we have the nervous system, endocrine system, and then ear and eye procedure. So these are all from chapter 6. So how the questions we are receiving mean? From endocrine system we are receiving one question, guys. From endocrine, one question, and then from nervous system we are receiving two questions, and then from ear and eye procedure we are receiving three questions, guys. So one from endocrine, two from nervous system, and then three from ear and eye procedure. So totally 6 questions you guys are receiving. Okay, so we have to discuss one by one. The first one is endocrine system. So endocrine system is one of the smallest system in our body. Mainly the endocrine system mean we have only the glands, guys, right? So thyroid gland, pituitary gland, like that. We have only the glands only. And one more thing, in these glands producing the hormone, right? So the hormone, because of that only, our sexual character, our behavior, height, everything will be happen. Okay. So please note down, guys. And one more thing, guys, from the endocrine system, the provider will not able to do the surgery, right? So maximum endocrine system mean we have only the injection procedure only. So it's not a big one. So everything is a injection procedure only. But only 2 location the provider able to do the surgery. What does that mean? Thyroid and adrenal. So first question what we are discussing mean we have to discuss about thyroidectomy, guys. We have to discuss about thyroidectomy. So from this compulsory one question you guys are receiving in your exam. So please note down this and update me.
Completed. Completed.
Is it everyone is completed?
Yes, sir.
Okay, guys. So next topic, what we have to discuss mean the topic is thyroidectomy. So the topic is thyroidectomy. So thyroidectomy mean we know removal of thyroid. So actually, the thyroid located in neck location, right? So these are all you guys already know. Guys, 1 minute, guys. Please give me 1 minute. Or else please note down this one, guys. I will be back. Okay, guys. So if you guys completed this slide, please update. Actually, I'm getting call from AAPC. So that's why.
Sir, completed.
Completed.
Okay. Okay, guys. So first we discuss thyroidectomy. So thyroidectomy. So we already discussed this is removal of thyroid. So the thyroid having two lobes, guys, right? So if you guys want to check mean, you guys please check in your code 60210. If you guys go and check in that particular code mean, you guys know. So the thyroid pictures they given. So the thyroid having two lobes, guys, right side and left side. Like that, we have two lobes. So guys, please concentrate. It's very simple. If the provider removing right or left any one side partially thyroid lobectomy, if they perform, you have to use 60210. Again, I repeat, right or left any one side partially the provider removing the thyroid, we have to use 60210 code. And then the right or left any one side totally the provider removing the thyroid, that time you have to use the code 60220. And then 240 mean total or complete thyroidectomy, which means entirely the right and left, entirely the provider removing. It's called as 60240. And sometimes the provider doing limited neck dissection, right? Sometimes the cancer spread mean the limited neck dissection they perform. So that time you have to use 60252. And then radical neck dissection mean 254. Guys, anyone having idea what is mean by radical, guys? Anyone? So what is radical? Anyone having idea? Radical. Okay. So always remember, guys, in your CPT book, wherever the provider documented the term radical, so its meaning is lymph node removal, guys. Lymph node removal. For example, in our body, many places we have the lymph node is there, right? For example, we have neck location, and then nearby breast we have axillary lymph node. In neck location we have cervical lymph node. Like that, some of the lymph node is there. So the lymph node work is, the lymph node will be producing the lymphatic fluid. Because of lymphatic fluid, we are getting fight against infection. Actually, lymphatic system is otherwise called immune system. So the lymphatic fluid will be go all over the body and fight against infection. Now, if the patient have cancer, for example, the patient having thyroid cancer, in case the cancer cell entering into the cervical lymph node, then what happen? So with the use of lymphatic fluid, it will be spread all over the body. So it is highly risky. So that's why sometimes whenever the provider performing the thyroidectomy, sometime additionally they are removing the lymph node also. So that time you have to use the code 60254. And last one 60260. So can anyone read the description, guys? What is 60260, guys?
Thyroidectomy, removal of all remaining thyroid tissue.
Can anyone read 60260, guys?
It's a thyroidectomy, removal of all remaining thyroid tissue following previous removal of portion of thyroid.
Yes. Right? Okay. So why I'm asking mean, if you guys read, then only you guys will understand this concept. That's why. So, for example, 1 year or 2 years before the provider perform partially thyroidectomy, now again it will be spreading all over. So this time the patient coming for removal of the remaining tissue. So this is called as 260. You guys clear? Right? So why I'm asking mean, you guys don't confuse 60240 and 60260. Both are different because the 60240 mean complete thyroidectomy. The provider will be removing all the things. They have to remove all the right and left, all the things they removed mean it is called as 60240. And then 60260 mean it's a completion thyroidectomy. The completion thyroidectomy mean previous tissues is remaining, so they have to remove that. That's all. This is the difference. Clear? But the completion thyroidectomy word, if you guys checking mean you guys don't have in your CPT book, because this is a provider using term. The provider personally they are using this term. So that's why I have to discuss you guys. Clear? That's all. So that's all about thyroidectomy. And next one you guys please note down. The next one is adrenalectomy, guys. The next one is the adrenalectomy. The next one is the adrenalectomy. You guys please note down the direct code 60650. Right? 60650. The description is laparoscopic adrenalectomy. Laparoscopic adrenalectomy. This is a direct code. So this is a direct one. So this is a direct one. Right? That's all. So from endocrine, we are receiving this question, guys. So we are receiving thyroidectomy and adrenalectomy. That's all. Actually, in your CPT book, if you guys check also, just to one page only you guys having the codes. From endocrine, one page only we have the code. So this thyroidectomy or adrenalectomy, directly you guys are receiving in your exam from 6 series. Clear? Okay.
So, one more thing. I want to know about 60699 unilisted procedure endocrine system. Can you define me where we can use this code?
Which one?
60699.
Okay, what is the description?
Unilisted procedure endocrine system.
Actually, for all the series, you have the unlisted code. The unlisted code we are not using in your exam. For all the chapter, all the topics you have the unlisted code. So unlisted code mean we are not using in your exam. So you no need to take care of that, because what does unlisted code mean? Sometimes the provider doing one complicated procedure, but in that procedure in CPT book we don't have any code. So that time we are using unlisted code, but unlisted code we are using mean it is a $0. So we are not using that.
Okay, sir. Thank you.
Clear?
Yeah. Okay. Thank you.
Yeah. So next thing is the nervous system, guys. From nervous system, we are receiving 2 questions. Mainly, the nervous system we have 2 type. One is the central nervous system. Another one is the peripheral nervous system. One is the central nervous system. Another one is the peripheral nervous system. In central nervous system, we have 2 things. One is the brain and spinal cord. In central nervous system, we have brain and spinal cord. In peripheral nervous system, we have the nephron, like the neurons will be there. So it's a nerve related thing. So in your exam, you guys don't have any question from peripheral nervous system. So you guys just leave that. So we have the question from central nervous system only. So we already discussed central nervous system mean we have 2 major organ will come. One is the brain, another one is the spinal cord. In this central nervous system, brain 1 question you are receiving, and then spine 1 question we are receiving. Right? So brain 1 question, spine 1 question. Guys, one thing remember, the spine question we are not discussing today. So whenever we are discussing chapter 2 musculoskeletal system, during that time I have to discuss the spine procedure. The reason, the spine procedure we have the question from 2 series as well as 6 series. So whenever we are discussing 2 series musculoskeletal system, during that time I have to discuss this spine procedure. So you just leave that. So remaining we have only the brain procedure only we need to discuss. So brain procedure mean majority of candidate they don't like, because the brain mean the anatomy parts also very difficult and they are not liking. So that brain procedure. But you guys no need to worry, guys. In this brain procedure, you have to code only based on the approach. So very easy. So you guys receiving only 1 question. That 1 question also I will tell you. So which question you are receiving like that. So is it very easy, right? So before that, I want to discuss some anatomical things, guys. Please note down. Right, some anatomy question we are receiving in this brain procedure. So the first one is, in brain we have one special fluid. What is the name of the fluid, guys? Anyone? In brain we have one special fluid. What is the fluid name?
Cerebrospinal fluid.
Yes, it's a cerebrospinal fluid. Please note down, guys. So the fluid name is called as cerebrospinal fluid. Okay. So next one is, actually the cerebrospinal fluid is shortly called as CSF, right? The next question is, the CSF located in ventricles of brain, guys. The CSF located in ventricles of brain, right? Ventricles of brain. And then next one, it is secreted from choroid plexus, guys. It is secreted from choroid plexus. It is secreted from choroid plexus. Okay. Right? So this 3 question is a recent question, guys. You guys have to prepare this. Okay. And the next one is the covering layer of brain and spinal cord. The covering layer of brain and spinal cord is called as meninges, guys. It's called as meninges. So covering layer of brain and spinal cord is called as meninges.
Manning.
And the last one, is lobes of brain. The last one is lobes of brain. Lobes of brain. So we have 4 lobes, guys. The first is frontal, and then parietal, and then occipital, and then temporal. Right? So this 4 guys: frontal, occipital, temporal, and then parietal. So these 4 lobes we consider as the lobes of brain. That's all, guys. So these are all the anatomical questions we are recently receiving. So please prepare. So tomorrow we have to discuss the coding part from brain procedure, as well as we are discussing from the ear and eye procedures. Clear? That's all, guys. So thank you, everyone. See you tomorrow, guys. Bye, everyone.
Thank you.
Thank you,
Thank you.
sir.